them join in once they log on. So we'll call the meeting to order. I'd just like to start off with a territory acknowledgement. Just want to thank the Wasonic people for being able to work, play, and live on their land. Looking for somebody to adopt today's agenda.
I can do that, Mike.
Thank you, Wayne. And looking for adoption of the October 21st Emergency Planning Committee meeting minutes. There we go. Thank you.
Buddy.
So we'll start with the first order of old business, and that's going to be a senior care facilities update. So I am still talking with these folks minimum of once a week. I did get a very detailed update from Amica Beechwood. No COVID cases to date. However, they're seeing a spike in symptoms. Like you said, no positive cases, but with flu and cold season, they're one facility that was really hit hard last year. So be paying close attention to Amica and to the other 6 as well. But they've really upped their game as far as visitors and staff, as far as entry into the building and out of the building. So single entry point, single exit point, temperature screening, full PPE has to be donned, just to try and take every precaution they can possible. So Amica has a very good national plan, so they're basically following what head office has provided them. And as far as the other facilities, any of the independent sites are quite unique, so they can't lock them down. These folks still are able to head for dinner with family. They're able to head into Sydney, so it's really just checking when they get back and making sure nothing's changed is when they left. And then the complex care places like Resthaven Lodge and Sydney All Care, the biggest thing for them is just the staff and any contractors or people that are visiting their site, making sure they're not bringing anything in. Any questions with our senior care facilities? Oh, we're good. Policy, the COVID safety plan. Randy, I don't know if you just wanted to talk to the group. That was the one that you rolled out earlier.
Yeah, thanks, Mike. Yeah, so the management team, along with myself, we've reviewed and updated our COVID safety plan. The biggest change that has been incorporated is the wearing of masks within all municipal facilities, in particular when traveling throughout our various buildings. So that's been initiated, and quite frankly, I think it's been very well received overall by staff. Certainly accepted. Haven't had really any pushback or concerns expressed about it, and staff are doing a great job in terms of following that new safety protocol. The other aspect to the safety plan that has been changed is just revisiting our maximum occupancy limits within our various meeting rooms, common rooms, etc. And myself, along with our safety officer, went and reviewed each particular room. So there's been some fundamental changes there. And then there's just some general housekeeping that was done on the safety plan. Really important, I think, that we review that safety plan on a more regular basis and make sure that it is staying current, and make sure that we're pushing that out to our staff on a regular basis as a bit of a refresher. So yeah, we'll leave it at that.
Perfect. And just updating the group, the COVID safety plan has been added to the town's website so that we are compliant with the one of the recent orders from Dr. Bonnie Henry as well. So next is the mass emergency notification system service provider. So we have provided notice to ERMS, who is our current provider, that we were going to terminate the contract with them effective December 20th, and that we are going to sign on with Connect Rocket as our new provider. Chief is working on a brief report to council just to bring them up to speed for what's going on. Definitely, the new system is more user friendly, and I think the biggest thing for us was it's more cost efficient. We're going to save considerable amount of money over the next 5 years with Connect Rocket. The current provider was sold to an American company, and they were changing the platform, and it was quite detailed. It was fairly intrusive for new registrants signing up. They wanted to know what we thought was a lot of information, and there was a lot of that information we weren't able to modify or remove. So we worked with the other two municipalities, because we're in this notification system together as Saanich Peninsula Alert. We did a lot of research. We did a lot of interviewing other municipalities that have used the current provider that we're going to switch over to, and heard lots of good feedback. So it was the recommendation of the group to not move over to the new provider and switch to the new provider that is Connect Rocket.
So Mike, do people have to re-register when you get onto that new system, or will it roll over?
Talking to the new provider, they're going to be able to grab all of that information in a file and move that data into the new service. And then we will work with them. They'll work with anybody that signed up with email. They'll send out emails to everybody that signed up, letting them know of the changes and anything that they have to do. And then we'll work through via text and phone calls for anybody that we haven't. So this new provider was seems and was willing to help us move this information for a smooth transition, where if we stayed with the current provider and switched to their new platform, it was going to be all on staff. So we were going to have to notify and let everybody know everything. So we're not looking to change the branding or any of the signs around town. It's just going to be a provider, and we'll work over the next month to advertise in the newspaper. We'll use our social media, and we'll also send some messages through our current provider advising people of the changes.
Sounds good.
I'll let Donna speak to flu shots.
Yeah, just an action item from our last meeting. We talked about putting flu shots on the town website, just where you can get them in Sydney and the peninsula through Island Health and pharmacies. So Krista was kind enough to put it on the website and share it frequently on social media. So that has been accomplished. Any questions about that?
Is there a cost associated to that?
Sorry, Laurel, what was
Is there
that?
a cost associated to that?
With flu shots?
Yeah.
Not that I know of, no. I mean, we're not really running them. It was more just we're advertising where you can go get them and making it that information accessible to the public so that people can just jump on sydney.ca and know where you can book them. We're not really doing anything more than that, but I don't believe there's a cost, no.
Okay.
Any other old business? No. New business, just wanted to update the group that we have applied through UBCM for an emergency evacuation grant application in the sum of $25,000. And this is to help review the evacuation procedures that we have here in the town of Sydney. They're quite outdated. So we're looking to be successful, obviously, and then work with Jim Lamort to update and revise our evacuation plans for the town of Sydney. And then a small component of funds that were requested would go to help with the REMP, the Regional Emergency Management Program, because they're working on a regional evacuation plan as well to help in the CRD region. So we're looking at joining on that as well. So if successful, that's what our plan is to do. And if not, we'll revisit. We likely won't find anything out until sometime in February.
Like when Jim does the the review and updating of the emergency evacuation. Is that something you think as part of that could be like a review for those of us that might not be directly involved, just so we have some be familiar with any changes or what the new plan might be?
Yeah, and part of our application was to work with our providers and people that support us in Sydney. So definitely your name was mentioned to Jim as working with the RCMP, and then we'd work with our public work folks, and then obviously for the fire department and the residents as well.
Yeah, sounds good. Thanks.
Roundtable. Does anybody have anything they'd like to discuss? Go ahead, Randy.
So Chief would probably want me to bring this up, and I know he probably would if he was here, but attending. But I know he's been in discussions maybe with yourself, Mike, and yourself, Donna, about the idea of whether or not the town should be considering standing up the EOC, given where we are with respect to an increase in confirmed cases on the island, and given where we are in the Lower Mainland, etc., whether or not there's merit or value in potentially standing up the EOC even at a level 1, which is, again, it's the least impactful sort of level where it would primarily be the chief, probably yourself, Mike, and yourself, Donna, in terms of meeting on a maybe every couple of days to discuss, where our response plans are at and whether or not those need updating. So really sort of dusting off the playbook in terms of what if we need to go there, what a broader EOC response might look like. To be honest, from my perspective, I would like to take a bit of a wait and see approach on it, just to see where any potential new orders might be coming, when they might be coming, see where we are at the end of this week, that type of thing. We're going to, early in December, have another, we're going to start up our administrators calls again, where we're going to be sharing information, etc. I'd like to get a bit of a perspective where other municipalities are in the region, and if other municipalities have also stood up their EOCs even at a level 1. So I'm leaning towards taking a more cautious approach to that, but wanted to get sort of the committee's perspective as well on that before any decisions are made.
Randy, I did sit in on a CRD call this morning, and it doesn't sound currently like anybody other than the CRD is working daily. The one thing we might think to do in the near future, sounds like a lot of municipalities right now are meeting like once a week. So, if it was yourself and the chief and myself with Donna, and we blocked a couple hours on maybe like a Tuesday morning after we hear what Dr. Henry says on a Monday after a weekend, and if there's any new orders. But based on the CRD, it sounds like everybody's kind of monitoring around a level 1, but really only coming together maybe once a week. So nobody's full-time, nobody's running level 2 EOCs at this time. So I think just meeting and updating on the cases. Donna, correct me if I'm wrong, the doctor this morning that we briefed with, a few weeks ago, before we saw a spike in cases on the island, we were about 1 positive test for every 1,000. And now we're 1 positive test for every 80. So it is increasing rapidly. Where we were seeing 15 to 20 cases a week, we're now seeing in a 24-hour period on Vancouver Island. So I think we just need to be cognizant. We did hear yesterday that there was one confirmed case in Saanich Peninsula Hospital. We're in that community transfer situation now, so it's really just monitoring and protecting the vulnerable population in the senior care facilities and acting when needed, I think.
Okay. Okay, well, maybe what we can do is we can have a discussion then. I don't know if there's any other, views or perspectives, but, I'd be happy to have a discussion maybe with yourself and the chief and Donna about looking to at least maybe have a meeting a week or something and discussing where we're currently at. I guess at the end of the day, if we start sort of, what I don't want to see, I guess, is just, us sort of announcing that we initiated an EOC level 1 and that sort of thing without making sure that other municipalities in the region are on the same stream as well. Because I know what it'll be like. It'll be, if we do it, then others are going to look to do it and that sort of thing. And all of a sudden now, there's going to be discussion about possibly opening up to a higher level EOC, within short order.
Okay.
Yeah, my concern would also be if we go to an EOC level 1 and people don't immediately follow. I'm just thinking of the feedback that we got before on how the town staff did. And there was a lot of misunderstanding where people believed that officials are being given information about specifically where cases are in a way that we aren't. And if we announce that we're going to an EOC before anybody else follows, I'm worried that people will leap to a conclusion about what that means about our local caseload that we can't support, especially since the only places we'd be told were, of course, the hospital and the care homes. And so we wouldn't know that in the community. I guess the second thing that I'm starting to wonder, although Sergeant Conley says nobody has been calling, is that since Dr. Henry is saying the transmission really seems to be gathering this in people's homes, and it's clear that the reason she hasn't tried to come up with greater enforcement about that is that it's basically impossible to enforce. And so I'm wondering if part of the discussion will need to be how, I don't know if there's anything we can do locally that they aren't doing provincially because the province is in the lead. Just about how to get in front of the messaging about the expectation of what the RCMP and bylaw officers would be expected to do in that case. And I'm hoping some of the discussions you've already had at the CRD level and things like that are kind of covering that about the coordinated response, the regional response that people are going to be expected to do. I'm worried about people, wanting us to really enforce masks and greater shutdowns, in the public realm that are not leading to transmission and that will cause large economic problems for our citizens. And then at the same time, not being able to, not having any mandate to enforce where the problem actually is, and what kind of discussions are being had about how we're going to handle that.
I think one of the things that, if my understanding is correct, that the mask piece is not an enforceable piece. Is that a shared view? It's just a recommendation seeking compliance.
Yeah, there's no order in place for masks at this time.
Right. Okay, thanks. One thing I would share is I think it was either yesterday or the day before, we had information about a family being exposed to a positive COVID case in one of our First Nation communities. But no specifics, of course, offered. So, all around the privacy thing. So it's a little bit, I guess it's a little bit difficult, right, to even gauge a response around that. As I understand it, it wasn't that there were any residents that themselves had tested COVID, but they had been exposed to someone else from outside the area. So I guess it's there, and we're gonna maybe get some inquiries about that, but it's almost like a bit of a case-by-case basis in terms of response, or even being able to protect first responders and all that all those different pieces.
Anybody want to speak to Wayne's
Yeah,
concern?
it didn't really need a response, just sort of was sharing that, Mike, so.
Sure. Okay, does anybody else have anything for roundtable?
Just a quick update on the official community plan. Am I muted? No, I'm unmuted. Quick update on the official community plan review project. I think most of you are aware, and the rest of you probably won't be surprised, but the event we had scheduled for early December has been canceled, or postponed, I should say. So we're hoping to reschedule that for early 2021 as conditions allow. If they don't allow, we'll look at some virtual options for engaging the residents of the community. But for now, we're sort of in a wait and hold mode with community engagement. So we'll see how it goes.
Okay, thank you. The next meeting is scheduled for December the 16th. So unless we see any new orders or spike in cases locally, we'll leave it at that date. And looking for somebody to adjourn the meeting. Thank you, Mr. Hissick.
Thanks, Mike.
Thanks, Mike.
folks. Take care.
Thanks all.
Thanks, Mike. See ya.
Yeah.